Hello everyone and welcome back to my channel. Today we're tackling an important topic in vascular health, giant cell arteritis. Whether you or a loved one has been diagnosed or you're simply interested in learning more, this video will cover what giant cell arteritis is, its symptoms, how it's diagnosed, and how it's managed. Hi, I'm Dr. Knapp, family medicine physician here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Giant cell arteritis, also known as temporal arteritis, is an inflammatory disease of the blood vessels, particularly the large and medium arteries of the head. It most commonly affects the temporal arteries, which run over the temples and supply blood to the scalp and brain. This condition causes the walls of the arteries to become inflamed, leading to a reduction in blood flow. If left untreated, giant cell arteritis can lead to serious complications, including vision loss. The exact cause of giant cell arteritis is not known, but is believed to involve an abnormal immune response. Genetic factors and environmental triggers might also play a role. It primarily affects individuals over the age of 50, and women are more commonly affected than men. So, what are the symptoms of giant cell arteritis? The most common symptoms include severe headaches, often localized to the temples, scalp tenderness, jaw pain when chewing, and visual disturbances such as blurred vision, double vision, or sudden painless vision loss in one eye. Other symptoms can include fatigue, fever, and weight loss. Some patients might also experience pain and stiffness in the neck, shoulders, and hips, a condition known as polymyalgia rheumatica, which often occurs alongside giant cell arteritis. These symptoms occur because the inflammation in the arteries can cause them to narrow, reducing blood flow and leading to tissue damage. It's crucial to see a doctor immediately if you experience any of these symptoms, especially vision changes, as prompt treatment can prevent serious complications. Diagnosing giant cell arteritis typically involves a combination of medical history, physical examination, and specific tests. Blood tests such as the erythrocyte sedimentation rate and C-reactive protein, or CRP, can help detect inflammation in the body. However, these tests are not specific to giant cell arteritis and must be interpreted alongside clinical findings. The definitive diagnosis is often made through a temporal artery biopsy. This procedure involves removing a small sample of the temporal artery and examining it under a microscope for signs of inflammation in giant cells, which are characteristic of the disease. Imaging tests such as ultrasound, MRI, or PET scans can also be used to detect inflammation in the arteries and support the diagnosis. Once diagnosed, the primary goal of managing giant cell arteritis is to reduce inflammation and prevent complications, particularly vision loss. The mainstay of treatment is corticosteroids such as prednisone, which are typically started at high doses and then gradually tapered down based on the patient's response and side effects. It's essential to start treatment as soon as giant cell arteritis is suspected, even before the diagnosis is confirmed, to reduce the risk of permanent vision loss. Corticosteroids are effective in controlling inflammation, but they can cause significant side effects, especially when used at high doses for prolonged periods. These side effects can include weight gain, high blood pressure, worsening diabetes, osteoporosis, and increased risk of infections. Therefore, patients on long-term corticosteroid therapy need regular monitoring and may require medications to protect their bones and manage other side effects. In recent years, other medications have been explored as potential treatments for giant cell arteritis. One such medication is tocilizumab, a biologic drug that targets the immune system to reduce inflammation. Tocilizumab can be used in combination with corticosteroids or as a steroid-sparing agent to help reduce the need for high-dose corticosteroids and minimize side effects. In addition to medication, managing giant cell arteritis involves regular follow-up with your healthcare team to monitor the disease activity and adjust treatment as needed. This typically includes regular blood tests to check for inflammation and assess the effectiveness of the treatment. Lifestyle modifications can also play a role in managing giant cell arteritis. Maintaining a healthy diet, engaging in regular physical activity, and not smoking can help improve overall health and reduce the risk of complications associated with both the disease and its treatment. It's also important to get regular eye exams, especially if you experience any changes in your vision. Support from healthcare providers, family, and support groups can make a significant difference in managing giant cell arteritis. Dealing with a chronic condition can be challenging, both physically and emotionally. Connecting with others who have similar experiences can provide valuable support and practical advice. If you've been diagnosed with giant cell arteritis, it's essential to follow your doctor's recommendations and communicate any new or worsening symptoms promptly. Early intervention and consistent management are key to preventing complications and maintaining quality of life. Giant cell arteritis is a serious condition that requires prompt and effective treatment. By understanding the disease, recognizing the symptoms, and adhering to a comprehensive management plan, it's possible to control the inflammation, prevent complications, and lead a fulfilling life. Thank you for watching. If you found this video useful, please hit the like button and subscribe to my channel for more health-related content. Leave a comment below if you have any topics you want covered in future videos. As always, take care of yourself and make the most of your day.